Hi, welcome to Tonnau Talks. Today we are talking about setting boundaries for highly sensitive kids. My name is Dr. Keris John. I'm the Senior Specialist SEPD Lead Psychologist for Neath Talbot Local Authority. And I'm lucky to have with me today Dr. Amy Munro, who has a specialism in highly sensitive children. Thank you for joining me today, Amy.
Nice to be here.
Oh, good. We're very lucky to have you, in fact. So, Amy, I was wondering, can you tell me what is a highly sensitive child?
Okay, so when we're referring to a highly sensitive child or sensitivity, we usually refer to two key areas. So a person who is highly sensitive can have that emotional sensitivity, but also sensory sensitivity as well. And what the term actually refers to is really a way in how a person perceives the world around them. Sensitive people usually kind of interpret the world around them or sense the world around them in a more heightened and intense manner than people who are not highly sensitive.
Oh, okay. So a highly sensitive child is ultimately a child who experiences the world around them much more deeper in a sensory sensitivity. So that's the things they kind of feel and touch and smell and things like that. And then you said like an emotional sensitivity. So that's related to our emotions then. So tell me, what isn't a highly sensitive child?
So I think it's important that we think about that term sensitive. When we say a sensitive child, it's not a flaw and it's not a characteristic that's a weakness in any way. In fact, you know, being a sensitive person brings a lot of positivity with it. So it's just that these children and people experience the world far more intensely. That means that they see the positive things more intensely as much as the stressful things more intensely. So what you will see if you do some reading on the internet or Google or whatever that might be, you might see the acronym HSC, which refers to highly sensitive children, or HSP, highly sensitive person. But it's not a diagnosable condition. It actually refers to a personality trait rather than a diagnosable condition.
Okay.
So it's important that we understand that when we see those that acronym.
Right.
I think, like historically, there's been a lot of interpretation of sensitive person being introverted. It's not necessarily the case that sensitive people are introverted. I think there's only a small percentage, according to like the research that's been done on this. There's only a small percentage of people who are introverted. In terms of anxiety, people who are highly sensitive do tend to experience anxiety, but it's not just about them being anxious. What we find is highly sensitive children or highly sensitive people, they have got that predisposition to be anxious, but it depends on the environment they're in. If they're in a really nice, calm, predictable environment, then, to be honest, anxiety is not always an issue.
Okay. That's really interesting, and I like how you started off by saying it's not a flaw. That it's not a weakness. And I think sometimes when people hear the term highly sensitive, we take that as like them being kind of drama queens, or they can't cope with demands and they're very avoidant or a bit hyperactive, or they've got poor social skills and things like that. And I know that that term highly sensitive child can be misconstrued as sounding like a child with autism, and I think from what people have mentioned to me before, parents, that they describe a child with autistic traits, and then they compare that to a child that's being highly sensitive. So it does sound like they're very similar, autism and a child who's highly sensitive. Is that right? Are they very similar?
There is an overlap in the characteristics. However, there are distinct characteristics that can also set them apart. So if we just think about the signs of a highly sensitive child just for a moment, before we come on to the autistic traits, I think we need to be sort of more focused on what a highly sensitive child might look like.
Yeah.
So when we refer to highly sensitive children, they might be those children who are really overwhelmed by loud noises or bright lights or strong smells. That sensory sensitivity is there in highly sensitive children. These tend to be children also that you can't just suddenly drop a change on them. They need more time to adjust to new situations. They are very empathetic and very intuitive children. So I've known some children who can pick up on the feelings of others before even those people know that they're feeling that way, all right? And these are the children that worry about how other people are feeling as well. So it's that emotional sensitivity that you will see. And of course, because they feel other people's emotions so strongly, these are the children that can have very intense emotional reactions to those surroundings as well. They pick up on adult emotions very, very quickly. And if you as an adult are not feeling too great, you can bet that your child's picked up on that if they're a highly sensitive child. And of course, because they're feeling the world in such an intense manner, it makes them more sort of prone then to perhaps having their own emotional little wobbles as well. Right. So we need to be very mindful of that. They can be triggered by other people's emotions as much as they can with the environment. If the environment is too loud or too noisy or too bright, we have to be mindful that they have got that lower tolerance for things that are possibly stressful.
Oh, right. Okay, that's very interesting, isn't it? How you know, when we're talking about maybe children with autism, that emotional literacy, that, you know, you're talking about that intuition, about being able to read other people's emotions before that person is even aware of it. That isn't something that we'd see with a child with autism. No. Okay, so that's quite a strength, isn't it?
It is. It's a very key strength for these kids, because you know, what do we need in the world? We need people who can read other people well and respond accordingly, considering other people's feelings. So, you know, being a highly sensitive child can be a very strong positive trait.
Yeah, absolutely. So I'm wondering what are the key differences then between highly sensitive people and autistic people?
Okay, so when we're thinking about highly sensitive children and autism, they're both examples of being neurodiverse. And we've all heard that term, neurodivergence or neurodiverse. It's just a way of referring to how our nervous systems react. And highly sensitive children have highly sensitive nervous systems, okay? And obviously autistic, you can have children who are autistic. Yeah. They can also have high sensitivity as well. But there are certain things that they have in common and things that perhaps are different. So in terms of like a highly sensitive child, they are children who perhaps might ask a lot of deep questions. Perhaps maybe what you find is that they build up a lot of worries throughout the day, perhaps, and late at night they'll start perhaps asking, oh, can we sit down, can we have a chat? And you'll have a lot of these deep questions coming out when they're ready to express that. Okay, so they're big, curious. You know, they've got a big, curious personality there. They can be very perfectionist. Okay. Children who are highly sensitive tend to socially compare from a very early age. They pick up on the smallest little details and are able to sort of suss out from the messages or the sort of distinct messages they get from other people around them how they're supposed to be or how they're not supposed to be. So that leads then to that social comparison. Yeah. And because of that, because they want to sort of please other people, and be perfect as it is, we can see this sort of perfectionism coming out, if that makes sense. Okay. They can be very inflexible to change, just like children who have autism. And that comes down to the way they're trying to manage their stress tolerance and their anxieties as well. If we have a key routine for them, a consistent routine, they're doing that to create predictability. So if something changes without any warning, they can experience that as being stressful. Yeah. They can be particularly sensitive to pain. Okay, because again, sensitive people who, it's about how they perceive touch as well. Yeah. So, you know, it's not uncommon for adults who are highly sensitive perhaps to experience chronic pain as well.
Okay.
Okay. And they are typically tuned in, as I said previously, really to the distress of other people. But the key thing to this as well is that when they go into new, perhaps busy social situations, they enjoy busy social situations to a point, but it can be very, very overwhelming for them. So you might find if you take a highly sensitive child to a party, they'll enjoy it for a certain amount of time, but then they'll hit a point and we have to go now because it's just too much for them to handle. Now, children who have autism might struggle with that, the social communication. How am I supposed to interact within this social environment? Because perhaps they have difficulties working out the social rules. A sensitive child understands all that, but they get overwhelmed with the demands of the social situation, if that makes sense.
And I guess that ties into the highly sensitive children being more intuitive. So they're more aware of everyone else's emotions around them and responding to that. So I can imagine that's really overwhelming. If they are with a large group of children, they're enjoying it, but actually it's like they get compassion fatigue in a way. It's like their battery just runs out and it's like, I can't cope anymore with this. Whereas a child who is autistic wouldn't know even how to start in a way to start enjoying those situations. So that's really, really interesting. So I'm wondering then, Amy, what does the psychology tell us about why children could be sensitive? Is it nature, nurture? What do we know about that?
Well, to be honest, it can be a little bit of both, but generally what you find is a lot of children who are highly sensitive, if you speak to parents of highly sensitive children, they will always say, well, actually, I remember them being a sensitive soul from the beginning. You know, these are the children, perhaps they were slightly more unsettled. Maybe when they were small infants, they needed a lot of skin-to-skin contact. They needed to be held a lot of the time. And perhaps if you're talking to a baby group, they perhaps again got overwhelmed with that situation, and you know, the children that you take to parties when they're little, they stuck to you like glue. They're not quite confident about going off to play with other children in the park, that sort of thing. So this is something we're thinking about, the development of the nervous system. Everybody's different, and basically you have some children who are born with sensitive nervous systems, and other children who are born perhaps their nervous system isn't as sensitive. So what we've seen from research as well is that you can have a sensitive child, and if they are born into a family which is supportive and there's lots of love, lots of care, that keeps their stress threshold at a point that is tolerable. And that sensitivity may never be an issue for them. However, for some children, unfortunately, if they're born into stressful environments, then that sensitivity is more of an issue for them then.
So it's kind of a bit of both. It's kind of a bit of nature and a bit of nurture, in fact. So I'm wondering then, how would you spot the signs of a highly sensitive child?
Okay, so again, we're talking about children that can get easily overstimulated, particularly in busy environments. So if there's loud noises or bright lights or strong smells, that can be one of the signs. These are children, again, these are the children who can't drop things on them. They need to have structure and they need to have routine. And if things happen in such a way that perhaps they're not expecting something to happen at that particular time, and you've promised to do something different, they will notice and they will pick up on that change very, very quickly. And they will experience that as quite distressing.
That I can imagine that's really hard for the parents too, because sometimes in life you have to change, don't you? Some things do change, and you know, if you're then kind of on tenterhooks in a way, aren't you? Like you're worried about, you know, upsetting the apple cart, because you're aware that actually that your child's going to find it very difficult, which is hard to see as well, isn't it? You know, and hard to manage sometimes.
And of course, these are children, they worry about the smallest things as well, perhaps things that perhaps wouldn't upset you or I as non-sensitive people. they'll worry about small things. So maybe the way somebody's looked at them, or a small comment that something said, or for example, I did have an experience with one child once that they saw something on television, which involved an animal, and they were worried about the animal being lost. So I think they were watching a film, if I recall, something like Homeward Bound, but they were worried about the dog being lost and never finding their family again. So, you know, they
get
need
very
a lot
invested,
of,
don't
they're
they?
very invested, and they get very sort of embroiled in lots of thoughts, really, that can be upsetting. And sometimes you need to just pick up on those worries and then say, what is worrying you? Let's sit down and let's have a little chat.
And I can see then how this trait can be misconstrued, with anxiety, because with anxiety we've got snowballing, which is kind of what you described then. It's like going down that kind of worry and then worrying more, and then as the snowball goes down the hill, it just gets bigger and bigger and bigger. Again, catastrophizing, things being far worse than they actually are. And I can see then why there's a lot of interconnections, isn't there, with these different types of things out there. And again, something like sensory processing disorder, isn't there? Because we're talking about highly sensitive children being highly sensitive to not only emotions but to sensory stimulus. So can you tell me what is sensory processing sensitivity?
So with sensory processing sensitivity, it's so what we find, and I know you mentioned sensory processing disorder, it is distinctly different.
Right.
With sensory processing sensitivity, you find that it's actually quite situation specific.
Okay.
So a child can be very easily overwhelmed in particular environments. So if their stress levels are higher, their tolerance levels for things like bright lights or loud noises, strong smells, when you're in an anxious state, your tolerance for those things it is basically much lower. Okay.
So are you saying, like, for example, then one day I could take my highly sensitive child to the supermarket and it'd be fine. The next day we go, nothing's very different. Absolutely. And they can't cope with that.
Absolutely.
Oh, okay.
It depends on how they're feeling at that time and where their stress threshold are.
Okay.
Threshold is, sorry.
Right.
So again, it can vary in terms, from day to day, how they will react in certain situations.
Oh, that's interesting.
Whereas somebody with sensory processing disorder, that's something different. That's how they are sort of integrating all the sensory information. That tends to be a problem all the time rather than situation specific.
Right, okay. So again, it makes it even more difficult for parents who have a child who's highly sensitive, because you just don't know. There's too many variables that can change depending on lots of other variables, and often variables that you as a parent wouldn't notice, because if you're not a highly sensitive person, you wouldn't pick up on these things either.
No.
You can see the challenges faced by parents, So we've talked a lot, Amy, about the difficulties that highly sensitive children have. And, again, the same with any, disorders that we may talk about, such as ADHD and ASD. There are always strengths. I meet children with ASD and ADHD, and I always tell them, you've got superpowers that, a lot of us don't have. And again, and I'm wondering, what sort of strengths do sensitive children have?
Okay, so if you imagine children who are highly sensitive, they are very empathetic people. They're actually very intuitive, because they pick up so much from other people around them. And like I said earlier, they can tell you how you're feeling before you know how you're feeling, and that is wonderful.
Strength. Yeah, absolutely.
And as adults, when they grow up to be adults, how wonderful is that skill going to be, because you can connect with people. When people feel understood, it makes them feel validated, isn't it? And to imagine sensitive people can really sort of connect with people. So it's important to remember that. Highly sensitive children is all because they remember and notice lots of sort of really detail. Then they do notice and observe lots and lots of detail. They tend to be very creative people. So you can have children who are very good at art, or they might be very good at music. So you would find perhaps that they might have more of that creativity, perhaps, than the academic.
Yeah.
But overall, they're very perceptive people,
Yeah.
and they tend to have very vivid imaginations as well.
Mm.
So it's thinking about those, but it's the social connection that they are very good at. They might get overwhelmed with social situations, but social connection is something that is a real strength for them.
So they can be, described as quite loving and affectionate and, really attuned to other people's emotions.
Definitely.
Yeah, that's quite a strength, isn't it? Thank you. So today we want to talk about boundaries, because that can be something very difficult for us as parents to put in place when we've got a highly sensitive child. Boundaries are hard enough to put in place anyway with a child who isn't highly sensitive. But in particular, we've got to be more mindful about how we set boundaries for our sensitive children, and how we can be successful at that. So how can we best support our sensitive children?
Okay, so let's think about boundaries to start with. So why would we set boundaries for any child, really?
Yeah.
Why would we set boundaries? Because it provides structure for them. They need guidance, and we need to help our children develop important life skills, really.
Mm-hmm.
So firstly, children understand acceptable behaviour, and it's help them develop that sense of discipline, really. If we establish clear boundaries, children will learn to navigate those sort of social norms and expectations. And that understanding contributes to the overall development, really, and prepares them for future interactions.
Okay. That's really important, isn't it, for all children, really, but also to be mindful that even though our children who may be highly sensitive, we kind of sometimes, I think when you mentioned about the difficulties that they may have, we sometimes want to protect them.
Absolutely.
But actually, these boundaries are really important for them, especially with developing those life skills as well, and those, to help them develop the relationships. So how would we go about setting these boundaries?
Okay, so what we need to think about is the different types of boundaries we can set. So we'd have to maybe consider, I would say, 3 areas. So maybe your physical boundaries, your emotional boundaries, and maybe your behavioural boundaries.
Okay, so you mentioned the physical boundaries, emotional boundaries, and behavioural boundaries. So what are physical boundaries?
So physical boundaries really sort of refer to personal space and touch, I would say.
Okay.
So teaching children about physical boundaries helps them to understand just privacy, really, privacy of others and respect for others' personal space.
Okay.
So it is really important to establish and reinforce those physical boundaries from a young age, I would say. So things like respecting other people's personal space by maybe just asking for permission before hugging or touching, or just entering someone's space in general.
Yeah.
And teaching children really to say and express any sort of discomfort or need for personal space themselves.
Yeah.
So if somebody's invading their boundaries, giving them the confidence, really, and teaching them how to express that positively.
Okay, and I guess if you're doing that as a parent by putting those boundaries, they can recreate what you're saying to others then, isn't it?
It's about teaching about rules, isn't it? How we want to be treated and how we treat others.
Yeah, okay. So what are emotional boundaries?
So that's about respecting your own emotions and the emotions of others. So understanding that everyone has the right to their feelings.
Okay.
And that it's important to communicate and express those feelings in a positive way, really. So again, sort of setting rules and guidelines for behaviour at home and in public, and reinforcing that behaviour yourself as a parent, isn't it? And then basically saying, like, well, actually, if we don't adhere to that boundary, this is what's going to happen as a result. So having those consequences, and that's what children need, really. They do need the guidelines and they need the structure. How should I behave? What happens if I do this, what happens if I don't do this? You know, they need that because it gives them a clear pathway through life, isn't it? What they should be doing and what they should not be doing.
Okay. So what about behavioural boundaries?
So it's things like having sort of effective communication strategies with your child, saying, well, actually, I'd like you, you know, this is how so you're going to help around the house, or you're going to just maybe having some chores, things for them to do. This is how we behave in our home. This is what we expect. And this is what you can expect from me in return, isn't it? So I think that, you know, that sort of making sure that it's a two-way thing.
Absolutely. And we know, you know, with the research coming out these days about the importance of children having chores in the household, you know, really helpful even for children who aren't highly sensitive. So, and I think that's what you've mentioned here with the physical boundaries and the emotional boundaries and the behavioural boundaries. It's all about setting them up for the future, isn't it? To be the most successful and capable adult they can be. And I think that's really, really important, is that we don't try and overprotect our highly sensitive children, and that within our parenting capacity that we try and enable them as much as we can. I'm wondering, when we're thinking about, you know, parenting and things like that, what else is important for our parents of highly sensitive children?
I would say 100% parental well-being.
Okay.
Because, you know, if you think you have a highly sensitive child who's taking in all this information in an intense way from their environment, it can be, you know, the highs are high with these children, the lows can also be low. And like you said, they experience stress very easily. And when we're dealing with somebody who's experienced stress, our own stress is triggered as well.
Absolutely.
So, you know, it can be quite difficult at times to keep our own emotions in check, and sometimes it can feel quite isolating as a parent, because if you take your child out and they're perhaps having a little bit of a wobbly moment in the corner because things are too much for them, and you look across and you see a perfect family with you know, no problems at all, you start perhaps not showing yourself that self-compassion that you deserve.
But you know, like we know when we look on social media and things like that of these perfect families, that's not all true,
nothing's ever perfect.
No,
you know?
absolutely.
So it's being kind to yourself, I think, is one of the most important things you can do.
Excellent. Self-care, isn't it?
Yeah. And of course, if we look after our own emotions, that keeps our child's stress lower as well.
And we're better able to cope with our child then, aren't we?
Absolutely.
You know, absolutely. So, you know, I think we've talked a lot about this, but just to briefly go over this, like why is it important to set boundaries? What are the benefits?
The benefits really is that it just contributes to their overall well-being. And you know, it keeps those stresses low, and keeps life predictable for them. But also it helps them to develop healthy relationships with other people as well. It's about learning how to be a person, isn't it? And a good, positive and productive person. And those boundaries and that guidance will be invaluable, really, to making them a full-rounded person.
Okay, great. So I'm wondering then, so why do limits and consequences matter?
Because it's simple, really. It makes children feel safe, and it helps them to know what is expected of them. So the other thing as well, it tells children that there's adults looking out for them, who are in charge and who are looking after them. So I think that is one of the critical things, is that children need to feel safe, and boundaries and structure really helps them to achieve that.
Okay, thank you, Amy. This has been really helpful, just to listen to what is, you know, a highly sensitive child, the difference between highly sensitive child and maybe children who have autism and sensory processing needs as well, and also to just help our parents, you know, in putting those boundaries in, because they're so important, and ultimately makes everyone else feel better, doesn't it? You as a parent feel better and able to cope, and your child is better able to cope with the demands of life, which can be very challenging for our highly sensitive children. In true Tonnau Talks style, we're going to go on to our top tips. So, Amy, could you tell us some of your top tips for our parents with a highly sensitive child?
Okay, so we're talking about emotions and how children manage their emotions. We want them to be able to manage those emotions in a positive way. But one of the key things you can do as a parent to help them achieve that is to normalize talking about feelings. So if you're having a bad day, it's perhaps saying, oh, I found this really difficult today. Oh, can you go and get me a cup of tea? You know, and then opening those those channels really for discussing difficult days and difficult feelings.
That's important, isn't it?
Yeah. The other thing is structure and routine. Again, these are children that do experience anxiety, and we know with anybody that has anxiety or has experienced anxiety in that way, structure and routine are crucial really in helping that predictability, making you feel more in control over your environment. Okay. So structure and routine is important. Listening and validating. These are as we said earlier, they worry about the littlest details. So it's opening communication, opening those lines of communication up, giving them an opportunity to talk, and not dismissing any feelings that they might share. Is saying, oh, that must have been really difficult for you.
Yeah. Instead of, don't worry about it, it's fine.
Yeah.
Stop being, you're overreacting now. And I think that's what a lot of parents struggle with, because again, it's one of those feelings that they aren't able to share with their child.
Exactly. But also, as a parent, again, it's showing that compassion. Sometimes we could probably all relate to that, where we said, oh, right, okay, don't worry about that now. It's because we're busy ourselves, isn't it? So but perhaps instead of doing that and, showing self-compassion as a parent, like I said, there's nothing wrong with doing that in some circumstances when we're busy, but it's actually saying, oh, right, okay, I can see you're really upset by that, and I can't quite do that now because whatever that is. But I promise you, we are going to sit down and discuss this in more detail.
Yeah.
And making an agreement to discuss that, isn't it?
And ultimately, just from that sentence, the child feels listened to and also validated, but also you've put in those boundaries as a parent then for that child to be able to hold that thought, to know that they are then going to be able to talk in more detail with you when you have that time.
Yeah,
it's important.
Absolutely. Again, having that safe space, finding that sort of time, if, for example, as well, if you're dealing with perhaps a little wobbly moment that your child's having, perhaps if things have got too much for them and they just can't manage those feelings, it's instead of keeping them in that situation, is finding a safe space to take them to. That might be very difficult when you're out and about, but it's minimizing the audience and taking them to a place where perhaps they can feel a bit more safe and secure. And you'll find taking them out of a stressful environment will lower that stimulation quite quickly.
Right, okay.
Quiet time is really important. It's thinking about, for example, if you have a child that's been in school all day, and for school for sensitive children can be very overstimulating and very overwhelming, is making sure when they come out of perhaps a long day that's likely tired them out, is perhaps not questioning them straight away as soon as they come home.
I hear a lot of parents saying, oh, ask them how school's gone, and they've just said, shrugged their shoulders, or said they've done nothing all day.
And I think we can all relate to that. So it's making sure that when they come out of a highly stimulating environment, whether that's a kids' party or school or even like the local park, that you give them time to readjust back into some quiet space so that they can sort of disconnect and bring themselves back down to zero. Okay. Power struggles. Again, with power struggles, it's very easy. Like I said, this is about parent protecting themselves as well. It's very easy to be triggered by a child when your stressors are higher as well. So it's making sure that you don't get into that power struggle with a child and try and argue, back with them, because sometimes they can get very, very overwhelmed. Sometimes it's easier just to perhaps create the space, have some breathers, and then come back into that environment when you can speak in a more sort of calm way.
Yeah, and I guess that ties into that point, providing safe opportunities for challenge. Tell me about that, Amy.
It's picking the time. So when basically, if a child is very distressed and very overwhelmed, sometimes if you try and challenge them when they're in a heightened state, that can lead to further overwhelm. Particularly, again, it's going back to that personal space, isn't it? If we put ourselves in a child's personal space when they're distressed, that can probably lead to perhaps greater distress. That would be, for example, pushing or shoving, and we don't want that.
No.
We want to make sure that we address a child when they're in a calm space. So it rather than sort of challenging at that time, it's reminding them that you're there, sitting with them, having that time in with the child rather than time out, and making sure that, you know, they're safe and that they know that you're there for them regardless.
And like saying things to them like, I can understand this is really tough at this moment, so I'm going to talk to you after, when we're all feeling a little bit better, you know. And it's about explaining that to them.
It is.
And it's not in a threatening way, like, oh, I'll chat to you later, you know, so that they start to worry. It's about, we'll talk about it, but when you're feeling a bit better, then you know. And it's about explaining.
But know that I'm here while you're feeling this way, isn't it?
Absolutely, yeah.
Because any language you offer at that point is not going to be heard anymore.
No. So it's more about what you do, isn't it?
Yeah.
What you show them rather than what you say. So again, that brings us really nicely into the opportunity to connect. Tell us about that.
Yeah. So creating those times, as we know, there can be a lot of worry with highly sensitive children. So it's creating that sort of opportunity to have those little discussions with your child, really, and opening up those lines of communication so that they know that it's safe to speak to you. And it could be that that's a designated time in the day. A quite common one is just before the child is, you know, while the child's being put to bed, they want to suddenly tell you about their whole day just as they're going to sleep. And if that is the time, then fine, use that time to connect. Maybe read a story, and then say, right, after our story, is there anything you'd like to tell me today? You know, what went well today? Was there anything that didn't go so well? So again, it's just helping them know that it's safe to speak to you.
Yeah, lovely. Thank you, Amy. There's some wonderful top tips there. And we've talked a lot about highly sensitive children, what that means, what that looks like, what it isn't. And also we've talked a lot about boundaries, how to implement them, and the benefits of that. And one thing I wanted to mention is that actually these boundary setting strategies that you've mentioned can be helpful for many children, not just our highly sensitive children. So I think it's it's really good. Thank you very much for coming on today to tell us all about highly sensitive children and parenting strategies as well. We are going to have some questions from some listeners who are listening live. So let me have a look. So we've had 3 questions come in, and they are, so the first one, Amy, I think my child is highly sensitive. How do I go about getting him a diagnosis?
Okay. So that's a tricky one. So in terms of like being a highly sensitive child, it's not a diagnosable condition. Okay. It is actually known to be a personality characteristic or personality trait. There's lots and lots of books and research out there by a key lady in the field called Elaine Aron, and she has lots of books out there that one specifically about a highly sensitive child. So we don't necessarily need to diagnose, but it's understanding your child and understanding the traits and the characteristics that they're showing. Within some of the work created by Elaine Aron, she has actually got a little questionnaire in there that is open for all parents. It's on her own website, which you can look up. It's hsperson.com. And on there is a little questionnaire that you can complete as parents, and that will give you an indication if maybe what your child is presenting with is high sensitivity. And then really it's drawing on all the advice we've given in this podcast, really. And like I said, there's lots of literature out there that you can refer to, which will help you as a parent to support your child in the best possible way.
Lovely, thank you. I hope that answer was helpful. So next question. My kid is really difficult to get out of the house in the morning, ready for school, as there's always excuses and things that irritate or upset her. What can I do? Okay.
Okay.
Very specific, which is
very specific.
Yeah, which we like.
But relatable.
Yeah.
Very relatable. Okay, so I think one of the key things is routine with this.
Okay.
Routine. So making sure as a parent, and I know it can be difficult, is making sure that you're sometimes one step ahead. So even if you have to think about the night before, right, okay, what do we need to do tomorrow? What am I going to need to get ready by the time my child gets out of bed? You know, and it could be if you've got a child that is quite sensitive with their clothing, that perhaps you, the night before, you agree what the child is going to wear with the child, and you put that out ready for them, so it's all laid out. Maybe you agree beforehand what they're going to have for breakfast, rather than waking up in the morning and say, what are you going to have for breakfast? Oh, I don't know, I could have this, I don't want that, it's too hot, it's too spicy, whatever it might be. Right? So it's about planning, and you know, planning is a key thing here. So if you can, and we're all human, try and be one step ahead, and try and get that sort of organisation done early, because that routine will be crucial into helping you to get out of the door in the morning.
Because it's very frustrating, isn't it? The morning rush, isn't it? And getting to school and maybe getting to work as well, getting the other kids ready, and you've got a child who's highly sensitive, and you know, it comes at the worst timing, doesn't it, for us parents?
Oh, it does, yeah.
But yeah, that's really helpful to keep that one step ahead. Yeah. Okay, our last question is, when I collect my kid from school, they say they've had a good day, but as soon as they get in the car, he starts to shout at me and becomes demanding. Is this normal?
Oh, okay. I think we briefly touched on this, didn't we, about, for highly sensitive children, the demands of a school day can be very, it can be overwhelming in itself. If you imagine they've got to go in to class, the class is usually noisy, there might be, you know, the smells from the dinner hall, there might be a supply teacher on that day, and the whole organisation of the day's changed. So it's being mindful that school can be a highly overwhelming place for children, and they do their best to pull it together, because these are children who want to please. They keep themselves together all day, and the minute they get in the car, that is their respite time. And I know, I think we touched on earlier, is questioning at that point is probably not the best thing. Is allowing them to get into the car, taking them home with minimal input if you can, just saying, hi, I'm so pleased to see you today, and maybe just leave that, you know, maybe put their own choice of music on in the car, take them home, and then allow them to have that downtime that they need. What I find is with highly sensitive children, they're very intuitive in terms of how they can sort of self-soothe themselves, you know. So they'll sometimes say, well, actually, I need time in my bedroom, or I need time on the Xbox. If that's what helps, that's fine, as long as we, you know, make sure we modify how long they're on devices for, but giving them time to engage in something that will help them relax. And then it opens up that lines of communication then.
Because we often hear from parents, don't we, that say they're an angel in school, that school don't have any problems with them, but at home they're a nightmare. You know, and that's real, isn't it? You know, it's not that, you know, they're doing anything wrong. It's just the fact that, like you say, they can only cope with so much. Their batteries run out by the time they get in the car, isn't it?
And home is their safe space, isn't it? And sometimes they want to control that safe space as best they can to make sure that they can function.
Okay. Thank you very much, Amy. It's been a pleasure to have you on Tonnau Talks today. And we do hope you come back. And I know our listeners will enjoy hearing all the advice and guidance that you've given us. So please scan this QR code if you'd like to access our live sessions. For those who are listening on our YouTube channel, we run these sessions live where you can ask questions on the topic. So thank you very much for joining us today on our Tonnau Talks and Setting Boundaries for Highly Sensitive Children.